Hi, my name is Tracy, and I'm the nurse that's going to be taking care of Miss Mary Edwards. Miss Mary Edwards admitted to our facility for fluid overload. She is a patient of Dr. Smeltzer's. Dr. Smeltzer has ordered today for her to have bumetazine 0.5 milligrams IV push over 60 seconds. So the first thing I'm going to do is just verify her med order. Again, I need two identifiers for my patient, Mary Edwards, 22 of 1940. She does have her ID band on as well. She has an allergy to penicillin. She is getting the bumetadine because she has heart failure and she's having some shortness of breath. All right. So again, that order is today. She's getting bumetadine 0.5 milligrams, or Bumex is what we also call it. IV push over 60 seconds. So the first thing I'm going to do is do my hand sanitizer or hand hygiene. I want to check and make sure that I am doing my 6 rights of medication. I have the right medication. I have the right dose. I have the right time, the right patient, and the right route. My patient is Mary Edwards. The drug is bumetadine. It's 1 milligram per 4 milliliters, or 0.2 milligrams per mil. So that means I need 0.5 milligrams, making it 2 milliliters. The expiration date on this is 4/2027, so it's good to use. I have my syringes with normal saline in it. We're going to give 3 milliliters before and after. I do have my syringe here ready to go with my 22-inch or my 22 gauge needle. I checked the allergies for penicillin. We're going to clean the vial. Some institutions say 60 seconds, just depends on your policy at your place of work, your employment. Okay. Now that we're done with that, we're going to draw this medication up. Bumetadine or Bumex, 1 milligram per 4 milliliters, or 0.25 milligrams per mil. So we need 0.5 or 2 milliliters. And the expiration date is 4/2027. Going to take off the cap. I'm going to pull back to 2. I'm going to push this in. And then I'm going to draw this up. Once I get it drawn up to where I need it, take it out of there. This is going to go to the sharps container. I'm going to cap the needle and take this off, and this would also go into our sharps container. And then I'm going to put on my clean gloves. After I put on my clean gloves, I need to check my IV site to make sure it's running. IV site looks good. There's no redness, no swelling, no inflammation to the actual IV site here. You always want to check and make sure if there's any coolness or any paleness actually to go along with this as well. We want to make sure that our IV fluids are running, and they are. Mine is just behind the camera. I will then clean my port. Again, it just depends on your your policies and procedures with your institution or your hospital on how long you're going to clean this port. This is a good time to explain why we clean the port. We clean this port because we don't want to introduce any infection, any kind of microorganisms or anything harmful into this tubing while giving this IV push. It's very easy to introduce pathogens into the line and then into the bloodstream. Okay, that's good and clean. We're going to take our normal saline flush. We're going to attach it. Here, let me put it this way so you can see. We're going to attach it. It's attached. And we're going to flush 3 milliliters. There we go. Do you see it going in? All right, it's flush. 3 milliliters going in. This actually drains on the other side, so it's got tubing that it drains out of. So I've just got it covered down there. We'll take this off, throw this into our sharps container. Get our medication, our bumetidine, which should have a label with the medication on it and today's date. It's that 2 milliliter bumetidine. Remember that's 0.5 because 0.25 is 1 milliliter. So I'm going to clamp my IV tubing and I'm going to start pushing this. I need to make sure that I aspirate first to make sure that I don't have any blood. No blood coming back. If I did, then I would want to push it just a little slower than the 60 seconds that's required. So I'm going to start pushing. Mary, let me know if you feel burning or any pain with this going in, okay? If you do, I'm going to stop it and I'm going to go notify my doctor. Okay. No pain. I'll throw this into my sharps container as well. I'm going to take my other normal saline flush. I let go of my line and now I'm going to flush 3 more cc's. Here we go. As you can see it going in. Okay. Once that's done, that's going to go into my sharps container as well. Again, I want to make sure that I'm assessing this IV site even after pushing the medication through, just to make sure there's no redness, no warmth, no coolness, no infiltration. Mrs. Richards or Mrs. Edwards didn't have any complaints with the injection of the medication. She tolerated it well. So my next job is going to be to go out and document on the MAR. So I'm going to take my gloves off. I'm going to do hand sanitizer and document on my MAR. I'm going to grab that hand sanitizer and documents. I'm going to document today's date. It's 2020 and time started was 4:15. It's on my name. Time ended was 4:16 p.m. Here's the documentation on the MAR for Miss Mary Edwards.